नमस्ते बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in Jayoti Vidyapeeth Women's University, Jaipur. In today's lecture, we are going to discuss about the clinical aspect of the GI symptoms, the symptoms of the gastrointestinal system. Whenever a patient of GI symptoms comes to us, what all the things that we have to do? From the knowledge of anatomy, we already know that our abdomen is divided into 9 regions. You can see this distribution. Number 1, 2 and 3 shows the hypochondrium. 4, 5, 6 the lumbar region, and the 7, 8, 9 shows the iliac region. 1 is the right hypochondrium, 3 is the left hypochondrium, 2 is the epigastric region. In the similar way, 4 is right lumbar, 6 is the left lumbar, 5 is the umbilical. 7 and 9 are the iliac regions. 7 is the right iliac, 9 is the left iliac region, and 8 is the hypogastrium. The present illness should be described according to the symptoms arranged in the chronological order. Chronological order means the symptoms that are coming first have to be mentioned first, and the symptoms that are coming later on have to be mentioned later on. Means the initial symptoms you will write first and the later symptoms will be written later on according to their development. The history of the patients with suspected GI disorders have a bearing on the clinical diagnosis. We have to ask the patient about the meal, the symptoms that the patient is having. You have to ask about the symptoms in relation to the meal. Some GI symptoms are either aggravated or relieved after taking food. That is, peptic ulcer symptoms. If the patient of the peptic ulcer is coming to you, the symptoms of the peptic ulcer are relieved by taking food or antacids. Conversely, the meal investigation, this worsens the symptoms of mechanical obstruction, ischemia, irritable bowel syndrome, that is IBS, and functional bowel disorders. Next is the pattern and duration of symptoms. The ulcer pain is intermittent, it is spasmodic, nocturnal, and it lasts for minutes to hours. Pain of the acute pancreatitis or acute inflammation, it lasts for days to weeks or for months. The biliary colic, that is, if it is due to stone, it is of acute onset and it lasts for several hours. Relation to fasting and stress. The diarrhea from malabsorption improves with fasting, while secretory diarrhea it persists without oral intake. Meals elicit diarrhea in some cases of inflammatory bowel disease and irritable bowel syndrome. There are various stressful situations which exacerbate the symptoms of functional bowel disorders. Relation to defecation, that is passing the stool. The bowel evacuation or defecation relieves the symptoms of inflammatory bowel disease and irritable bowel syndrome. You also have to ask about the history of any prior surgery. The obstructive symptoms with prior abdominal surgery, it suggests adhesion, whereas loose stools after gastrectomy or gallbladder excision suggest dumping syndrome or just cholecystectomy diarrhea. You also have to ask about any history of recent travel. The symptoms onset after recent travel suggest enteric infection, that is known as the traveler's diarrhea. We also have to inquire about the medication or drugs. Medications or drugs produces pain and altered bowel habits or the GI bleeding. The upper gastrointestinal bleeding, it results from the diseases of esophagus and stomach, whereas the lower GI bleeding is likely to result from diseases of colon, that is neoplasm, diverticular or the vascular lesions, or inflammatory bowel disease or anorectal abnormalities like fissures, piles, proctitis, etc. You also have to inquire about any kind of sexual contact. A sexual contact raises the suspicion of sexually transmitted disease or immunodeficiency. Now, this is a very important criteria that is known as the Rome's criteria. The most widely acceptable symptoms that are based on the criteria is the Rome's criteria for irritable bowel syndrome. It states that the symptom duration of at least 12 weeks in preceding 12 months, such as abdominal pain or discomfort with any of the two of three features, that is, it should be relieved by defecation. The onset has to be associated with change in frequency, and the onset is associated with change in the stool forms. So this was the introduction about the various GI symptoms, that how you will be able to inquire about those symptoms and what are the importance of certain things in the examination of a patient. In the next lecture, we are going to see the importance of the hepatobiliary symptoms in the history taking of a patient with GI disorders. In this series, we will be discussing about the various questions or the importance of various questions we are going to ask in the hepatobiliary symptoms or the GI system. So this was all about GI symptoms. In the next lecture, we are going to discuss about the importance of hepatobiliary symptoms. This session was powered by Digital Version 2.0, Jayoti Vidyapeeth Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.